Josh, Dr. Folkers, welcome to the Meat Mafia podcast. Pumped to have you guys on.
Thanks for having us.
Dude, we were saying that we've been loving what you guys and the Get Blokes team have been doing from, just the perspective of really helping men understand the metrics and the levers that they can pull to really be healthy. I saw some statistic on your Instagram that we're really not what our fathers were anymore. I think that's what you guys said, how I think in 1980, the average male testosterone level was around 500. Whereas now I think the average level is around 300. It's just like things have absolutely plummeted. And, we think that there's not enough attention being drawn towards it. So just appreciative of you guys coming on, and we just love to learn a little bit more about your stories and, how the business ultimately got started and everything you're doing now.
Yeah, I guess I'll start, and then Jacey can really dive into the clinical side, because that's a very relevant statement. And I'm a little bit of a conspiracy theorist, so I have my logic of why that's happening, but why it's not being talked about. But we'll start with the founder side. So I've been in healthcare for almost 15 years, and Jacey and I actually met in a previous life. We used to run regenerative medicine clinics, i.e. stem cell clinics. So we treated every joint, osteoarthritis. And we were really doing well. And then this thing happened called COVID. And because of the treatments we did, and because of the demographic of the patients we treated, basically was 60 plus. If you know anything about osteoarthritis, it starts setting in when you're 50s and 60s and 70s. So we were treating a lot of knees, a lot of hips, a lot of shoulders. And those people weren't leaving their house, and they certainly weren't spending a lot of money on any type of elective procedures that were $5,000 to $10,000. So, it was kind of the perfect storm to say, what are we going to do? And at the same time, I was going through my personal struggles with my health. And, I'm sitting here in my mid to late 30s trying to figure out where my sex drive went. And my wife was on the other end of that. She said, hey, listen, if you don't get your sex drive together, I'm going to divorce you. And that was literally a comment and a thread that had happened for a long time. And I went through the standard process of going through a primary care doc. And then I went to another one, and he told me I was on the low side of a range, but there's nothing I could do. And then I finally found a hormone specialist that was really deep into testosterone replacement for men and women, and it changed my life. And, the perfect storm was our entities in regenerative medicine stem cells were going to a different parallel, and this personal side. So Jacey and I decided to form this company and elevate men and start finding a way that we can do this easier with more accessibility while not losing or sacrificing the clinical side. And what we find so often, and hopefully your audience understands this, is that medicine has become so specialized, and hormones are no different. And sometimes our biggest antagonists are other doctors who don't practice in these special, niches of healthcare, and hormones and peptide therapy are very, very specialized. So that's really the genesis of how it started. And then JC can certainly chime in and really talk more about the clinical side of this.
Let's take a minute to talk about some of the sponsors and brands who support the show.
What are you thinking?
I was thinking about Carnivore Bar. What are your thoughts on Carnivore Bar?
I mean, it's unbelievable. It's an unbelievable product. We were lucky enough to have the founder, Philip Meese, on the show a few months ago, and he was able to send us a bunch of product when we started the relationship, and absolutely loved it. I mean, it's minimum ingredient product, beef, tallow, salt, and then they do have a honey flavored option as well. But it's so nice to have a bar that's like 3 to 4 ingredients. And like when you're following a carnivore diet, it's really tough to find products that are in line with that specific diet,
Yeah, for me, it kind of hits like the holy trinity of what you're looking for when you're looking for food. So it's nutrient dense, it's convenient, and it tastes great. And as you said, most people who are trying to eat healthy, the convenience factor is kind of a tough part. So just being able to have something you can grab on the go, know that you're going to have that nutrition for the day, it's huge.
Yeah, and we were lucky enough, we got to actually see their factory too in Missouri, and they're just doing things the right way. I love how they offer an option for like carnivore purists where it's just beef, tallow, salt. And then they also have an animal-based option too if you do want a little bit of sweetness, a little bit of variety. They have the honey in that option. And they're just people that are doing things the right way. They're very mission focused. They're carnivores themselves. And, we're always on the go. We're traveling. We've taken a bunch of flights together. To have a bar that has 30 grams of fat too, like that's huge from an energy density standpoint, right?
Yeah, he checks all the boxes, or the company checks all the boxes. And I just think the fact that they're sourcing from a regenerative farm as well, and Joyce Farms, just a win-win.
100%. So carnivore bar. So we got the affiliate link, and then it's code MAFIA for 10% off.
And then another one of our sponsors, one of our favorite farms, Holy Cow. What they're doing at Holy Cow is pretty remarkable. The relationships that they've built in the industry and how long they've been doing the grass-fed, grass-finished regenerative model is really innovative. They were one of the first people to be doing that and supplying whole foods early on. Just a great community farm, and also just the product is something that speaks for itself.
Yeah, I think number one, to your point, Harry, they're just incredible people. We got to hear them speak at the Beef Initiative conference in Colorado. We had never met them before, but just hearing Warren's story where they were following a standard American diet, he had had a heart attack, and they were just looking for answers of like, how can we actually get healthier? Do I need to be dependent on medication? And they started changing their diets to incorporating more animal foods, and he completely reversed those symptoms of his stroke. And now they're just doing things the right way. They're grass finishing their beef. They're incorporating incredible practices. They have great relationships with the animals, and they're very passionate about just like connecting directly with the customer and also educating their customer on grass finished beef.
Yeah, and I think the best part is too, they're shipping nationally and trying to reach a bigger audience. So being able to not only supply beef nationally, but also educate people on the quality of good, clean, whole foods is just, it's an incredible mission.
How much do you love their beef bacon, by the way? I know that's your go-to.
Dude, it's one of the best things I've ever tasted.
It's that good.
No, honest to God, it's so good.
Holy cow.
Yeah. One of the other farms that supports us is Perennial Pastures, another regenerative farm out of San Diego. Our experience with Kevin Munoz, the owner, we had him on the show, a young first-generation rancher who's really empowered by this movement of regenerative agriculture and really wants to be a leader in the space. I think our conversation with him was so insightful, just in terms of how mission focused he is and how he really thinks about his farm as a business and wanting it to be here 50, 100 years down the road, even though he's just the first generation of it. And I think just being able to spend time with him out in San Diego was kind of the perfect indication of that, where we got to go have a meal with him at his house, hang out with his wife and kids. Like, what an amazing person. And I think his mission focus around raising really high quality beef and restoring nutrients to the soil is just one of those rare missions that I think everyone can get around.
Yeah, he has such a commitment to really feeding the local community in San Diego, in the San Diego County, first and foremost, but he's also passionate about feeding the community around the country. So I know they've invested a lot of time, a lot of money, a lot of resources to being able to order beef in bulk on their website. So I know that they now offer quarter, half, whole cows directly off the website. They have that great ancestral blend ground beef product. So it actually has organ grinds mixed into the ground beef. So you're getting the benefits of like an ounce or so of organ meat, but because it's in the ground beef, you really can't taste it at all. And I think to your point, Harry, just another amazing person. Kev was someone that he was following a paleo diet in college and started realizing, wow, when I nourish my body with real foods, I feel amazing. Had a really successful stint in tech, but realized that there was just something else that he was passionate about. So he's one of those rare cases where, he put his money where his mouth is, and he's a first generation farmer, just, bootstrapping this thing, raising money, and just so passionate about feeding the community. Just an amazing guy.
Yeah, absolutely. What are your thoughts on organ supplements, and what do you think about the company that supports our podcast, Optimal Carnivore?
Such a good question, man. I think organ meat is something that's gained a ton of notoriety the last few years, and for good reason. I don't want to speak for you, but I think both of us have had a ton of benefits just incorporating organ meats into our diet. I would say that, we definitely prefer the raw source of organs, where we'll just, chop up some liver and some heart, and, there are different ways to prepare it. I think the raw source is the most nutrient dense, but we're fortunate that there are companies like Optimal Carnivore that exist that freeze dry organ capsules so you can actually take them on the go. There are a ton of times where we're traveling where we're not going to have access to raw organs. So I can throw a little Ziploc bag together of optimal carnivore and be good to go. And I think 6 pills is an ounce of organs, which is like the daily recommended amount that will give you a lot of those really good quality vitamins in there. So that's kind of how I think we've been using it. Did I miss anything there?
No, I think the fact that it just makes organs accessible to people. And I think that organs are generally just a food group that are underutilized when it comes to eating nose to tail. And the nature's vitamin is a perfect name for these organ foods. And I think a lot of people are pretty, in the mainstream object to eating organ meats. But when you put it in a pill form doesn't taste bad, it's convenient, you can put it in your backpack, it makes things a lot easier. And I also think that just generally these brands Optimal Carnivore is focused on making people healthier, which is just such a strong mission. And, I think liver capsules is a great way to get people thinking about their health differently.
100%. There's probably someone that's listening to this right now and you're interested in organ meats, but the taste might make you a bit squeamish. You feel strange about eating raw foods. Maybe you cook liver and you don't like it. Maybe it has a metallic taste. I think that's also where the organ capsules play such a great role, is that you're still getting that nutrient density, but you're getting it in a very convenient capsule-like format, and it just takes away any of that squeamishness that you might have to the taste. It's just a great product. And also Richard, who runs Optimal Carnivore, he's started listening to the show really early on, and he's built his own organ supply chain and is just doing things the right way and really trying to support the right people in the space. So just proud to be associated with them, honestly.
Yeah, absolutely. Thanks for listening. Now we're going to go back to the show.
Yeah, absolutely. So I've, my background is originally, I got my doctorate in chiropractic. And for like the last 25 years, I've really kind of dove into postgraduately in functional medicine is kind of what we call it, or, looking more for a root cause approach to healthcare. And so, from a clinical perspective, I worked with patients. I kind of emphasized for a lot of years on autoimmunity, because there's really no such thing as an autoimmune specialist. And, a lot of patients that I would work with, interestingly, what helped me help them was moving them more towards like a protein, animal-based type of a diet, getting away from the plants, getting away from all the things that they were reacting to, the grains and that sort of thing. And part of this is testing, lab testing, looking at patients' biomarkers, and exactly to your point. So I've been doing this for over 20 years, close to 25 years. And I noticed over and over and over again for men and women, low levels of testosterone, it just was like a very consistent thing. And then me being in a brick and mortar clinic, seeing patients one-on-one, I felt like, man, I want to help more people. I just want to figure out a way to help more people versus I want to help the people that I'm responsible for, but I want to be able to educate because there's something going on. And so, Josh and I, we would just talk about, our own personal struggles with energy, with, business and that sort of thing. But me personally, I wanted to have be a part of a company that allowed us to reach further. And so, this allows us to educate the masses. And that's why I have so much appreciation for guys like you guys that are, creating these podcasts to educate, to share this type of information, because yes, there's something going on. And here's the thing, not only is testosterone dropping decade after decade, but it's getting lower in younger and younger individuals, men and women. And there's a lot of pieces to this. It's not just, we're not just looking at one marker, we're looking at a lot of markers. And so we see a lot of things happening with increased inflammatory markers, with decrease in certain, nutrient markers, vitamin D. We're being told to not eat salt, and which is actually furthest from the truth. So there's a lot of misinformation. There's the paradigm that we have been told and taught has been just wrong, and so Josh and I we just want to kind of like dedicate ourselves to sharing the truth, and we want to have a proactive, preventative approach to health versus a reactive approach. And that's why we kind of work to start this company, and we're really working our tails off. But we love what we do, and we feel like there's such a need for this.
I love how your guys' stories complement each other really well. And Jacey, you mentioned the testing aspect of this whole health journey. I feel like a lot of people just like aren't really intuitively paying attention to their health. They kind of like let things slide until it gets to a point like where what Josh is dealing with, where he wakes up one day and is having a hard conversation without even really realizing what's wrong, or like he knows what's wrong but doesn't know how to find the fix. So
Right.
How do you guys go about having these conversations when you do have a solution like what you guys are talking about with the TRT, and also like diet and lifestyle playing a factor in it? Because that's like kind of like the root cause, right? Like we're not getting what we need from our diet and lifestyles.
Yeah, I think, to your point, a lot of us Americans, we're kind of like brainwashed to delegate our health to a doctor that's trained to treat symptoms. So we're in a system. The system's broken. It's kind of set up to address pathological conditions, not really take ownership of your health and take responsibility for your health. So that is what we emphasize. Like, look. And I use this phrase a lot, like to patients, I say, the real doctor of the future is the patient. Like we need to teach patients how to be owners of their health, how to take responsibility. And that's why I have so much appreciation for guys like you, guys like the Sean Bakers, the Ken Berries, the Anthony Chafees, because these are guys that are trained as MDs, right? So they learned you have this marker that's out of the range. Here's a pill for that, right? And so they had to go into the trenches and learn on their own the real root cause, the lifestyle approach. This is what I've been doing for 25 years. I mean, this is, I didn't have the ability, like Josh always says, hey, Dr. Folkers, the best thing about you is you never had a prescription pad. And so my prescription pad is like your kitchen, is your gym, is your supplements and things like that. So when we do labs, we test labs and we read them in a way that is more of a functional range. We want our guys or an optimal range, if you will. We want our patients to look at markers and understand them in such a way. It's not only looking at the markers that are out of range, that are in the red, but understanding biomarkers in a way like this is optimal for an optimal human. I mean, most patients people don't know this. When you go to a lab to get your labs done, most people don't get out of bed and feel amazing. Like, hey, I'm going to go get labs done today because I feel so good. It's usually you're sick, right? You're feeling like crap. So the doctor orders some tests. So you're going to get labs done when you feel subpar, and you're being compared to other sick people.
Yeah.
So those ranges are that you're being compared to are ranges from other sick people that go to that lab. So there's just, that's not how I interpret labs. So I have that conversation with them like, okay, this is where, you are here, which is not where we want you to be. We want you to be here in this marker. And so there's some nuances to that, but yeah, it's kind of, it's having a more of a root cause approach, more of like, don't wait until you're sick and you feel like crap. And that's how we approach patients is more of that, let's take action now. And that's why we have answers such as supplements, peptides, hormone optimization when needed. And there's a lot of ways we could talk about with that, but if Josh has anything to add to that, feel free, buddy.
No, I listen, I think you guys, you talked about it a little bit ago. I think the most important thing that JC said, and I'll take myself, for example, a long time ago, I was a horrible patient. Like I was the definition of not seeing a doctor unless I had something broken. Mm-hmm. And I think the most important thing that patients can do now with so many resources out there outside of us, like forget just us, like look at the macro picture of the United States. You really have to own that journey and you really have to get ahead of things before they become problems. And we believe that labs are the most precise way of doing that. We know it is the most precise snapshot at that moment in time for preventative and proactive care. And if my best friend, my sister, or anybody came to me and asked how often I should be getting labs, I would say no less than one solid baseline panel a year, maybe even two, depending on what you're doing, whether it's optimization, whether you're trying to fix something. But now I've kind of become somewhat of a geek into the labs and just like knowing my levels. And it's well beyond testosterone. I've literally been able to manage my cortisol levels, my stress, my inflammation so much differently, my insulin levels. And I couldn't do that without the power of knowing. And I think we have a lot of guys that are more like me when I was younger, where I didn't really care. It wasn't even part of the agenda. And then you have a fair amount of guys who just don't want to know. And I think collectively as men, we got to take less of that lion mentality and start helping our brothers out. And because, we're seeing so many dramatic things happen in society with testosterone levels, with sperm counts, and just overall health and wellness it is sick care. We like to say, like, we're trying to upend sick care by empowering individuals. So 100%. That's it.
It's so well said. And I'm just curious, guys, what, from your perspective, not like what the average is, and the average is a bad metric because the average person is probably overweight or obese. What is the ideal testosterone range that you guys think that healthy males should be shooting for? And then also, what are just some other baseline metrics that you think men should know in regards to like cortisol or just any other things that they should be tracking and know through this blood work?
So the first thing I'll say is, honestly, every man, every body is completely different. And I'll say that, but because there can be a guy that feels absolutely amazing at 800. There can be a guy that feels like complete garbage at 800 for total testosterone. But we find overall most guys feel pretty darn good when they're 850 to like 1200. So, but I will share this with you. There's been studies done that have shown men over 40 where, and I think they took about 2,400 individuals, and they divide them up into 4 groups. And pretty much everyone that was under 550 had increased risk of cardiovascular conditions, cancers, a lot of health issues. And in these men that were over 550, those risks were declined. So the problem is insurances don't even identify or feel a man is hypogonadal until he's below 300. Wow. And so I think that's just not, to me, clinically ideal. So listen to the patient first of all, but they're definitely kind of like what you brought up before. There's been a significant decline in total testosterone. If you look at like gentlemen that were like from the 1940s and 50s, it's thought that the average man's testosterone was like 1,200.
Damn.
And now it's like like nothing. And so, and here's the thing too, I want you guys to understand, like we're talking about testosterone, which is so important. I think another component of our health care industry and system that's broken is we tend to compartmentalize our health. There's a specialist for the heart. There's a specialist for GI. There's a specialist for different parts of our body. And guess what? The specialists aren't often talking to each other, And so it's kind of like we have to kind of realize everything, like Josh said, everything affects everything. Your cortisol, your testosterone, your estradiol. Men need estradiol. Estrogen is so important for men. And a lot of guys don't realize that. A lot of guys demonize estrogen, like, oh, I got to keep that down. Estrogen actually provides a lot of the benefits that we feel are related to testosterone, like libido, cognition, heart health, bone density. Those are all driven by adequate estrogen. And so we need estrogen. So, but all these hormones, thyroid, everything is affecting everything. So we have to understand the body is kind of like a symphony that's happening all the time. And that's how we approach it. Obviously, we want a man's testosterone to be where it should be because it does kind of have a downstream effect to all these other components. So,
and to iterate on, or just to emphasize what Jacey said, I'm going to almost guarantee, unless you are a very special case, and I'm talking cancer or some crazy autoimmune issue, your other doctors are not talking to each other. And this is why you're seeing such a emergence of functional medicine practitioners that are really trying to analyze the whole body, not only from a prescription side, but a nutritional side, a lifestyle side, a supplement side. And I think, it's a good thing that that's starting to happen, but it's something that society lacks so much. And I think I read somewhere that the average primary care doc spends 7 to 9 minutes with you on your first visit. And then maybe you're even lucky to get them after that. But if somebody's not talking to you about lifestyle and nutrition and supplements along with these therapies, then you're at the wrong place.
100%.
Maybe if we could just like dive into the diet and lifestyle stuff a little bit deeper. Cause I'm curious, like if there's someone who comes to you guys, are you guys seeing like a common trend in terms of things that they're doing or not doing that are factors that are working against their testosterone or hormones being like in a healthy range?
So yeah, like a lot of patients, that we work with, I mean, there's definitely a fair amount of people that metabolically are very unhealthy, right? And so, there's like, I like to call, regarding testosterone, there's like 4 common things that will contribute to lower testosterone or destroyers of testosterone. It's high cortisol, high insulin, high estrogen, and oxidative stress. And so a lot of people that obviously are following more of a standard American diet, a lot of the carboholics out there, a lot of people, consuming the processed, carbohydrates, the foods and the packaged foods and all those things. I mean, that's driving up inflammation. That's also driving up insulin. And that is causing stress on your body. So just from following the standard American diet, you're hitting all 4 of those things.
Yes.
And so what I always emphasize in these patients, prioritize protein. And when I did functional medicine, all the years I've done functional medicine, there are tests that I've ordered, food sensitivity tests, leaky gut tests. And it's interesting, a lot of the people that had, like, once again, all these metabolic issues, as well as all of and we do a lot of food sensitivity testing through Blokes and Joy. Guess what foods that they're most often reacting to? Vegetables. Brilliant. Yeah. So it's the nuts, it's the plants, it's the vegetables. And when we move these people more towards a animal-based proteins type of a diet, a lot of their inflammation goes down. A lot of the symptoms that they had, brain fog, digestive issues improve. And so there's definitely significant merit to having people focus on just a more of a healthier protein diet, healthy fats. Because guess what testosterone is made from? It's made from cholesterol. So getting adequate healthy fats in the diet. Eggs are one of the best foods there is, really. So in fact, if you were to break down the bioavailability of protein, eggs is 100%.
Wow.
You get, and then if you move down that, beef is like 80%, chicken is like 79%. And so as you move down towards plants, you're really getting, next to, nothing. So you have to consume so many plants to get protein from those sources. So all these patients, when we move them towards more of a kind of a, I guess now, I never called it a carnivore, when I was doing it. Now it's like, these guys, it's a cool term. I'm a carnivore, but I mean, that's really that type of a template heals the body, and it's what the body responds best to. And I think it's a combination of giving you the good, healthy proteins, as well as removing those interferences and those things that cause inflammation and stress on the body.
Sorry, were you going to say something, Josh?
No, I was just going to say, like, a kind of a common theme. Like, sometimes it's really hard to predict certain patients, because we'll have certain athletes and we're like, geez, man, he's really low. Like, that doesn't make any sense. And we talk about this a lot. And then we'll get this guy who's, kind of pudgy, and you're like, Jesus, how does he have such a high testosterone score? But I think you can categorize, like, for the most part, you can say these are common things that are going to drive a guy's score lower and symptomatically feel that. But like Jacey pointed on something that's so important. There are guys that can live and breathe at certain ranges and others can't. Like they just feel like crap. And it's not always about the score. It's so often about asking the right questions, making sure the symptoms match the scores. And sometimes they don't. And then it's more probing and more digging. But typically if you're following a good diet, you're eliminating smoking and drinking more often than not. We tend to see guys come in with much, much healthier lives and lifestyle.
Right.
Yeah.
And something to add real quick to what Josh is kind of alluding to is like, testosterone is not just sex drive, libido, muscle mass, lifting weights. I mean, there's so much more to it. A guy can, having low testosterone, it'll affect your sleep. It'll affect your mood. It can cause depression. It can cause just lack of motivation. It's very difficult to lose weight, gain muscle, having that belly fat. So those are like all linked to low testosterone as well, and just lack of concentration. And so that's why it's, I just want people, like, as I talk to guys all the time, like, my testosterone's fine, because I'm getting good erections. My sex drive is what it, and guess what? We check it. It's like in the tank. You know what I mean?
Yeah.
So then you start to probe more and you're like, I do have that. I do. Yeah. My wife has mentioned I'm kind of a jackass and kind of been, so yeah, I mean, there's a lot more to it than just sex and muscle mass.
Yeah, it's such a good point. And I was just curious, do you guys find that there are a good number of patients that will come to you and just immediately expect to want to go on TRT, stem cells, peptides, and they're almost like surprised or put off that you're first talking to them about diet and lifestyle and some of these preventative things that they can control before you get them on, exogenous solutions?
A lot of patients actually appreciate that. It's just, because what most doctors, that's just not what they're going to educate. I mean, unfortunately, most medical doctors, they just do not, this isn't what they learn. This is not their wheelhouse. They have to go above and beyond to learn like nutrition. And that's why I have so much appreciation for those that do. But I think the patients appreciate like someone to kind of talk to their lifestyle, their exercise, their nutrition, because it's like you're listening to them and you're kind of like helping them where they are in their life. Which is, I think, unfortunately, a lot of medical providers just don't think patients are going to be compliant no matter what they tell them as far as lifestyle. And so, but yeah, I mean, it's not just about testosterone either. Like Josh and I, we recommend things like Clomid and Clomiphene. There's supplements out there, so it's just kind of like every individual what it requires to get their testosterone at an optimal level is unique to them. And not everybody needs TRT. And they're, that's why it's a unique approach. We have to listen to the patient, find out like what their diet's like, because guess what? How they eat can dictate why their testosterone is where it is. And we can tweak that. And maybe they're not getting adequate sleep. How they sleep can dictate their testosterone. Maybe they're stressed out of their mind, or they have some underlying infection that can affect their testosterone. So you really have to kind of dig deeper. And with that, I find people really, really appreciate that.
Yeah. And I'll say this too, guys, like you can still be a turd on testosterone. Like it's not the magic solution just because you're giving yourself weekly injections or cream or whatever you're doing. Like, we strongly feel that if you make the adjustments, if you're doing the right things by supplementing your body with testosterone or Clomid or Clomiphene, you're just going to get there quicker. And, you're going to feel a lot different by doing that. But I mean, God, I know how I was when I first got on it. It made me feel different. But if I wasn't doing stuff in the gym, if I wasn't eating right, I still was kind of a turd, So, you still got to make the right decisions when you're on your own.
What are some of the how quickly do you guys tend to see results when you do put someone on some sort of treatment? Is it something that happens pretty immediately, or does it take like months to start seeing some of that turnaround period?
I think it's a lot of it, like what Josh just said, it has to do with like, are they putting work in, are they making changes? So for my dad, for example, he's 72 years old and he does work out. He does try to do the right things. And we started him on TRT, and he told me within 2 weeks, he's like, Jace, man, I feel strong. I'm not sore. So he was already noticing changes and benefits from the treatment, but it's because he has a baseline that's a measuring stick. If you have, like Josh said, if you're a guy that's sitting on the couch watching TV and you're giving yourself an injection, you may not feel much. You're just kind of like, yeah, I'm still sitting around. But it's like you definitely will benefit from doing fine tuning your nutrition, being more active. What I do like about testosterone is what I say a lot is testosterone makes effort feel good. So once you get your testosterone levels more optimal, you're going to all of a sudden want to just like move and be active and engage and not be the lazy guy and not want to use your body for what it's meant to do. So it kind of varies, but most individuals, which is why we coach, which is why we encourage them to kind of start meet yourself where you are. If you don't know what a dumbbell is, at least start walking. Just kind of like start to be more active. And what we also notice, people start to notice they sleep better. Like I'm actually sleeping a little bit better since I started this a couple of weeks ago. That's why we do follow-ups. We do regular follow-ups to kind of see. And I would say pretty much across the board, to some degree, every patient, for the most part, notices some improvements within that first month.
Do you guys find that there are patients that they almost like lump in TRT with anabolic steroids and it gives it a bad rap in a lot of cases and they don't properly understand what it is? Okay.
I'm glad you brought that up. That's such a good point.
We find that other physicians do that same thing. Mm-hmm. We find that other, call it what I guess we would consider professional influencers that have healthcare backgrounds do the same thing. And just because it's on the internet and just because it's on social media doesn't make it true. But our proof in the pudding is that we treat a lot of patients on this on a clinical side, and not everything can be on a white paper and studied at 20, 30 year lengths.
Yes.
But we see this day in, day out. But yeah, sometimes our biggest antagonists are other medical professionals.
And another interesting thing is kind of a double-edged sword, because like the gym guys, the bodybuilders, and there's definitely a lot of individuals out there that abuse testosterone and get their hands on all these other anabolics, and that's what they use to achieve these huge muscles and strength gains and that kind of a thing. But guess what? We've learned a lot in this space as a whole from those guys, and what the human body can handle and what it does. But I mean, we are prescribing therapeutic doses. We're prescribing patients, getting their levels in optimal ranges. We're testing them. We're managing patients. And unfortunately, like there's a lot of these clinics out there that put guys on just kind of a cookie cutter program. It's like any guy that has, two legs and, and a brain, they put them on testosterone and basically start them on the same dose. They put every guy on an estrogen blocker, which in my opinion is doing them a huge disservice, because you don't want to block estrogen. Estrogen is very important for men. And if it's too low, that can be detrimental to their health in a lot of ways. It's been shown that if estrogen is below like 13, it can increase the rate of death like 317% of all causes. Wow. So it's super important. So we have that approach where it's not cookie cutter at all. It's very individualized. And we're prescribing, like to start low and like to move slow and like to kind of like test, make sure that our patients are feeling the effects of it. And it, like we said before, everyone's individual. Everybody's sweet spot where they are in terms of their blood work, because by the way, there are two markers that you want to really pay attention to when it comes to testosterone. There's total testosterone, right? Where that's the number that we always talk about, the 850, the 900. Well, then there's free testosterone. So that's what's actually bioavailable. And I've seen patients that their total testosterone is 1,000 and their free testosterone is like 10. I mean, they have like nothing available. And there's certain things that can contribute to that. There's albumin levels, there's sex hormone binding globulin levels, not to get too deep in the weeds, but these are things that can bind up your testosterone and cause it so that you don't have that much available. So all the more you have to have an individual approach, and you want to treat each patient as an individual. But it's just but also not abuse this stuff, because it's great, but you too much of a good thing isn't always a good thing.
I don't know. I like a lot of good things.
He does like a lot. Don't we all?
No, I think the key, guys, there is replacement. Like, we're not, when you look at the anabolic side or the statement that you made about the bodybuilders, that they're not replacing. They're
right.
adding, rocket fuel on top of rocket fuel, and there becomes a diminishing return. And there also becomes a diminishing return when your levels are super low as well. So, our theory amongst many in this space is that we are replacing what we think should be there. It just happens those numbers fall in that range that Dr. Folkers talked about earlier. So I think that's the most important thing to talk about, is just we're replacing what we think should be there.
As you guys are seeing people who are like younger and younger come and maybe find you guys, do you guys think about this as something that can like catalyze the change to get you to like naturally be in a balanced range? Or is it something that you're kind of like get on and then have to kind of continue to manage and use the TRT kind of indefinitely?
Well, that's typically, so like if you're talking like a younger man, that's where we want to definitely do a deep dive into the labs. Is there something underlying? Like recently, I was able to identify a guy that had like high prolactin. So he had actually a tumor that's more common than you realize, that actually causes low testosterone. But that's where if everything's just like looks good and it's mostly like lifestyle related, low testosterone, then something like Clomid or enclomiphene might be ideal, because the way those medications work is it actually works by turning on your natural production. So it's increasing luteinizing hormone and FSH, and causing your body's natural production to increase versus like Josh, versus replacing it. So we are actually aiding and assisting in that young man's own testosterone production. And in that case, maybe we could at some point wean them off of that to see if that is able to jumpstart their body's natural production. But it's just kind of, once again, on an individual basis. But you don't always want to like put a guy on TRT too young, and sometimes I think in some cases there is merit for that if they have like complete shutdown of their production. But there are tools that we have that can actually definitely assist with the younger individuals.
Got it. Jacey, what age do you think would generally be too young for TRT? Is that like under 30?
I'd say like more like 25 and younger. 25.
Got it. Cool.
Yeah, it's rare, guys, that this is obviously provider specific and physician specific.
Really, it is.
It's rare. Like, yeah. 35 and younger is probably about where it kind of cuts off. And, but there's really amazing tools outside of that. If there is an issue, it's concerning that we are seeing more and more young guys having lower and low testosterone scores. And what's even more concerning is they're having symptoms that accompany that lower score, because if they had a low score and they felt fine, it really wouldn't make any difference to us. And it becomes a clinical decision at that point to say what's right for the patient.
Got it. Yeah, and I get too that we're asking like I think pretty generalized questions to solutions that are like very personalized too. So we appreciate you guys asking them. But it is funny because I've heard people joke about how like millennials and younger are like the sexless generation, how like no one's having sex anymore, and it just makes you wonder like all these young guys that are like being exposed to estrogen and not eating the right foods and having direct access to pornography, like what that's actually doing to your sex drive. It's so interesting.
Yeah, I might have saw the same article. I think I maybe went down the rabbit hole when I heard Elon Musk talking about how we're actually depopulating versus like an overpopulation problem. And I didn't actually know that until that. But yeah, you guys are right. Like guys are not having sex until very later years. And I don't know if it's pornography. I mean, I think we can assume certain things. I think a lot of it maybe is like dating apps where you're not out meeting people. You're not stimulating yourself in any way with a female, or I guess maybe a male in that case too. But either way, the trend is downward for sure. And Jacey says this all the time: you're not the same man your grandfather was or your father was. And I'm more curious to know why the hell we're not talking about this more, and why we're not talking about sperm counts more, and what is the, I guess the master puppeteer. You know, where are we going with this? Because it's not good. We need masculinity. We need testosterone. We need healthy testosterone levels. We don't want low testosterone levels because that leads to bad things. It leads to mood changes. And, you know, I think we, you know, collectively need to start talking about how we change this.
Do you guys have any hope for the legacy system and how it works? Because it is so like mechanistic and like siloed off, as you guys were saying before, like only diagnosing part of the problem and not taking a holistic approach. It almost seems like it's just destined to kind of fail until there's a system that can replace it. But curious if you guys see any glimmers of hope.
I mean, that's kind of what we're trying to do with this company, is basically create a different kind of a cultural norm. And, you know, it's just, it's a shame. I mean, I've been in this space for so long, and it's honestly, it feels like it's only gotten worse. We live in a symptom driven medical system, and it makes a ton of money. You know, unfortunately, it's you know, the stuff that a lot of the things that Josh and I love to use and love to recommend and love and personally and for our family, for our friends, is our products and peptides that, like, you know, are not patentable. They're not like, you know, big pharma is not going to use these to make billions of dollars, but they make a difference. I think the peptide space, I feel, is the direction medicine should be going, but there's just not profit in those things. And so it's just, that's what we're trying to do. We're trying to kind of, I guess, if anything, build awareness, you know, join podcasts like you guys to, you know, to share this information. And, you know, I think a lot of it too, like what you mentioned with the millennial stuff too, is just like, you know, we live in a day and age where information is just so available. It's not always the right information, as well as, like, you know, all our technologies are you know, are so available. And we have all these dopamine hits happening all the time. I mean, I have a 16-year-old that's like just on her damn phone all the time, and I don't know how to get her off of it. But I feel like, you know, there's some scientists that kind of like liken dopamine as like a cousin to testosterone. So think about it. If you're always getting these like dopamine hits and doing, you know, looking at your social media and looking at or gaming or whatever it is you're doing that's giving you these dopamine hits, it kind of like pornography, for example, it kind of like you're satisfying those desires. And so it's just kind of, I think that is part of the puzzle, as well as poor nutrition, as well as, you know, just poor lifestyle, lack of exercise. And just, you know, I think we're kind of like in a day and age where we tend to celebrate laziness, right? Everything's just, you know, like, man, it's just, there's a lot of laziness anymore.
I'll say this, guys, like, regarding your question, I don't think the system is built for that type of model. Like it really isn't. And I think the more consumer driven health decisions can take place that are not dictated by insurance, the better off we're going to be. I think I look at insurance completely different than I did, you know, in my 20s and 30s. I look at it as the oh shit thing. Like, if I get something catastrophic happen, it's great for that, but it's failed us in preventative and proactive care. And I think it's going to take some really drastic shifts, some people with a lot of money to really step in and own this market. I think you're seeing the same thing happen with Mark Cuban and his cost plus, medication pharmacy. And, whether that's going to put a big dent in pharmacies or the pharmaceutical industry right now, no, not really, but it could over time. And I think we're slowly seeing that in this side of the space, but it's going to take a big player to really change the game.
Yeah.
I think a question to answer, and I'll just ask, is like, what is, for the most part, what does insurance pay for? Right? It pays for surgeries, it pays for medications, it pays for diagnostic testing that usually doesn't really matter. It's which determine which surgery, which medication to take. So unfortunately, that's like Josh said, that's our insurance model. It's there for emergency situations, is when it's ideal crisis care. But when it comes to, unfortunately, we're using it for maintenance care, which is just it's just unfortunate. But it's not built for for health, really.
Well,
Yeah. Go ahead.
Guys. I was just going to give you a quick example, because we talked about the regenerative medicine clinics that we used to own.
Yep.
And we would see 5 to 6 patients a day, and that would keep the lights on really effectively.
Yeah.
Because at the end of the day, like, healthcare is a business. You got to make money to keep it thriving, at least in our current state right now. And when COVID happened, we realized that we couldn't do that. We couldn't be a one-trick pony. We had to diversify, and we had to start taking insurance. And the insurance game is honestly the most fucked up game I've ever played in. And, let's take it, for example, our Las Vegas clinic. We had to get, 10 to 12 different insurance carriers just to service those patients in that Las Vegas metro area. And then we were fighting tooth and nail just to get Medicare average rates. I mean, I'm talking 75% of Medicare reimbursed amounts. And then you start dealing with these 10 to 12 different carriers, and they all have different systems. They all have different things they're going to pay for, different drugs, different therapies. So as a small clinic, an individualized clinic, it's so hard to keep up with. As a patient, you have no control over that. Yeah. Your insurance is going to tell you exactly how many visits you can have, exactly what blood markers are going to run, exactly what drugs they're going to pay for. And I think it's bullshit. I think it's horrible.
And what that does exactly is, when you think about that from a doctor's perspective, now you're dictated by what your patient's insurance pays for, which is nothing. So you're in your best interest to help the patient is not what's going to keep the lights on at the end of the day.
And the thing that changed too with us is we ended up getting, let's say we got 80% of the carriers in that metro area. We had to see quadruple the amount of patients to even come close to what we were making once before. So there's no way in hell, and any doctor can argue with me, and I'd argue him twice on Sunday, the quality of care goes down when you see the value and the time that goes into those visits. You cannot, as a primary care doctor in our current traditional insurance-based model, you cannot offer lifestyle guidance. You can't offer nutrition in a 7-minute visit. You can't do that while you're prescribing, while you're diagnosing. And I think that's why you see such a massive burnout in healthcare right now. And that's why you're seeing such a massive collaboration and these big health systems getting bigger and bigger and bigger.
Yeah. And you're brainwashing the customer ultimately too, because I'm sure that there are people that come to you that love what you guys are doing. And then when they find out that it's not covered by insurance, they think it's crazy. When what's really crazy is to be paying, using insurance to go pay for some Western doctor that's just going to blanket prescribe you a pill or a drug to every single situation. Like when I had ulcerative colitis for 6 years, I was on a biologic drug that worked really well until it didn't. And it started giving me terrible cystic acne. So I kept trying to go from dermatologist to dermatologist. I probably had like 5 to 10 minutes per derm. They were just prescribing me antibiotics. I couldn't even get that derm to connect with my GI to figure out if the medication was for me to take. And it was an absolute shit show. And it was really like me going carnivore and eating really good saturated fat and getting a lot of sunlight and managing stress. That was the stuff that improved my gut and improved my skin. yet none of that was being talked about. I had to go do my own research and connect with people like you to figure that out. It's just really interesting what we've accepted as a society.
Yeah, it's scary. I'll give you one other example, because we deal a lot with weight loss. We do a lot with these big drugs and peptides that everybody's talking about. They're called GLP-1 medications or GLP-1 agonists. And a big name that's getting a lot of press is called Ozempic or Wegovy, the Kim Kardashian diet, the Hollywood diet, where people are just losing weight like crazy. Well, my sister-in-law, we prescribed her a compounded version of the Ozempic Wegovy drug, semaglutide, and it was a very affordable price. And she wanted to go through her insurance. She thought she had great insurance, so we go through her insurance. We help her get it prescribed. We help her get it covered. By the time she got that done, that was a 90-day process to even get approved for the actual medication. And then by the time she actually got to the bill, she was paying double what she was paying us for almost the same therapy. And it doesn't make sense that is the arduous process. And then the end result is, oh my God, instead of coming out $300 a month, I'm coming out $750 a month for the name branded version for something that is almost equally as effective to her. So it's a vicious cycle. It's a bad system. It needs massive disruption. We're trying to play our little percentage of it. And I think it starts with consumers owning their part in this process.
It's so interesting. This topic of insurance is so interesting to me because it like distorts the risk factor around health, which should be something that is kind of like you should really understand like the ramifications of eating a bad diet is going to lead you to having way higher healthcare costs, but insurance just lays this blanket over that. So it like just really leads you to the driving down this incentive path that makes you sicker and sicker. Yep. And all your habits kind of just follow in place. One of the sponsors of our show is actually, it's really interesting. They're creating like a crowdfund healthcare model. And cool. That model to me is cool because they group people together and then their incentives are aligned where you're contributing monthly to like a shared pool, but like, who else is in the community and you can opt in to help pay for other people's healthcare costs, but you can also opt out. And then like everyone sees who's contributing and who's not. So like when that moment does happen, like most people are like, yeah, I'm going to pay for that person's cost because they paid 100% to everybody else. Which in my mind, it's like that kind of like rewrites the incentives a little bit. That's a cool model that could potentially work.
Yeah.
Totally.
That is
I like
cool.
that.
Kind of bring it back into like the supplementation realm and some of the other protocols you guys offered. We talked about TRT, and I feel like that's a little bit more mainstream. But I think we were saying before we hit record, I'm very interested by peptides, and I couldn't even give you a good definition of what peptides actually are. So could we kind of break some of that stuff down and how they could be useful to certain people?
Yeah, absolutely. So we have peptides in our body at all time. You're familiar, obviously, with what a protein is. It's a long chain of amino acids. Peptides are just shorter little chains of amino acids, and so they kind of go around. They're more or less signaling compounds. They tell your organs and things to, what to do. And so we carry peptides, we prescribe. So it's kind of like to give you an idea of like how that differentiates from like a pharmaceutical drug. You take a medication, a prescribed drug, it oftentimes is inhibiting a biochemical process in the body, whereas peptides are more guiding your body and allowing your body to do what it already knows how to do, only better. So there are peptides that help with increasing the pituitary gland's ability to produce growth hormone. So there's peptides that are signaling that help optimize healing and recovery. There are peptides that we can prescribe that help with cognition, that help with libido. There are even peptides that help with tanning your skin. So it's cool. There's a lot of great products that we have. And like Josh mentioned, there's GLP-1 agonists are actually peptides that help with optimize, weight loss by helping with appetite suppression, as well as one of my favorite topics is insulin resistance. So these peptides can help improve insulin sensitivity, will help optimize your body's blood sugar dysregulation, which a lot of Americans, as you know, have insulin resistance. And that is probably one of the things that you can blanketly say is contributed and connected to almost every chronic health condition that there is, So, but yeah, I mean, we have peptides, that's why we ask, hey, what are your goals? What is it you're looking to do to improve your health? And we can come up with a peptide or peptides that help satisfy that patient's goal.
What sort of things do you guys see from like a longevity perspective? Because I imagine like there's a lot of people who come to you later in life, like Dr. Folkers, you were talking about your dad. Like, do they recapture their health in a way like they're able to sustain that sort of like youthful energy for longer?
Oh, absolutely. I mean, all the things that we do and that we prescribe are designed to kind of, help you not, feel better, but also function better. So, feeling, improved cognition, improved, composition, body fat, muscle is a byproduct of how you live your life. And so these products that we prescribe and we put people on, if anything, they act as catalysts to kind of get you to doing the things that you should be doing and used to be doing. I mean, one thing, for example, that testosterone offers is it has a very nice, significant pain reduction as well as an anti-inflammatory component to it. So joints feel better. It just, like I said before, like it makes effort feel good. So people want to go to the gym, want to just start, get down and play with their grandkids and that sort of a thing. And we even have peptides that help with healing of injuries, of ailments and things like that. So yeah, we definitely see individuals feeling better, looking and acting younger. So it's pretty awesome.
Awesome. Well, gents, we really appreciate this conversation. I think our audience is going to get a ton of value out of this. I think it's clearly something that you guys are passionate about and you guys have the service, but it's so like underappreciated in terms of how many people are actually talking about it. So just appreciate you guys doing what you're doing. And if you guys wouldn't mind just letting people know where they can find you and what resources maybe you guys would recommend in terms of going to start thinking about these things in a more critical way.
Yeah, it's super easy to find us. It's blokes.co. And if you wanted to schedule an appointment, it's as easy as just scheduling an online consultation. It takes about 3 to 5 minutes to fill out that paperwork. Our admin team contacts you within the same business day, Monday through Friday, and we help you determine whether a lab's necessary or not to meet with the provider. Typically it is. We can send a lab technician to your home. You can go to a draw station. In some cases, we'll send you an at-home test. And then you meet with the provider and you're off to the races. And, if not, though, we're not the only ones out here doing it. Find somebody who specializes in hormones. Find somebody who specializes in peptides. And I tell everybody that an easy way to tell if a physician does this for a living is to ask them what their payer mix is, meaning what type of patients are they seeing on a regular basis. And if, call it 50% of them are hormone related or peptide related, then you're probably in good hands.
I love it. Yep. Well, you guys both dropped a ton of knowledge and value this episode, and it's just really clear that you're very passionate about what you're doing. And it's also just encouraging that there are business and medical practices like you guys that exist that are really trying to like get under the hood and truly help make men be healthier and do that through preventative practices. So Jacey, Josh, thank you guys so much for coming on the show, and thank you for the work that you're doing, and just looking forward to staying in touch with you guys.
Likewise. Thank you for having us.
Absolutely.
Yeah, thanks, guys. Really appreciate it.